Yeah, let's start with the second part of the module 17, lipids. We'll talk first about the cell membranes. Cell membranes are membranes that semi-permeable, and they support the cell and its integrity and shape. They allow the selectively ions and organic molecules to go in and out the cell. The very important function of the cell membranes is to protect the cell. As you can see, those are the phospholipids bilayers, and the top of this, if I put this the top, those are the top here. All this top here, you can see here, this top here, and the bottom. Those are the polar part, the polar heads, and then the chain are the chain and non-polar parts. And you can see of this lipid bilayer, you'll see this is the carbohydrates, very important role. It plays a big role. And then you have those channels here, the proteins, different channels, different proteins. So this is integral protein. This is peripheral protein. This is channel protein. And this is globular protein. And this is glycoprotein. Here it is, sorry. Here it is. So their proteins is very important to help transfer or diffuse the ions or molecules in and out the cell. Remember, the bilayer is from outside the cell. So I'll show you in a minute here. This is just the outside the cell, protecting the cell. And outside the cell, if I put here, for example, outside the cell somewhere here, outside the cell, and outside cell is here. This is aqueous aqueous solution that's outside the cell. And what's protecting the cell is this one here. This one here in the bottom, this is inside the cell itself. So let's get a picture of this. You can see it. Yes, let's zoom this one up. So here it is. If you look at this, this is the nucleus. This is the nucleus. This is inside the cell. And this is the cell here is protected by this bilayer, correct? Lipid or semi-membrane lipid. So phospholipids. And you can see here, this is the one is the protector layer from outside, this bilayer. So the top and the bottom. And those proteins here, you can see this is a protein here. This is a protein. This is another protein. Those allowing the ions or molecules going from outside the cell. And this is cytoplasm, cytoplasm that's inside the cell, correct? And this is the cell membrane here, 2 layers. It's just like a belt outside the cell, protecting the inside the cell from outside, correct? And here outside the nucleus, we have the cytoplasm here. So all this here is inside the cell, but this is outside the nucleus and called the cytoplasm. So we can see this now, the cell membrane, they have the function really to protect an outside bilayer to protect the cell, cytoplasm, whatever inside it, and the nucleus inside. And inside the nucleus, we have seen in the first part, they have the DNA, mRNA, and all the other stuff, all the hormones interaction with the nucleus content. So this is just a picture show you how the bilayer cell membrane looks like, just protecting. And you can see here, there, just look at this here, just show you where is this, where is this cell membrane located. So let me go down a little bit. Yeah, go up. Here is the typical cell membrane composition. It is lipid bilayer, correct? And this bilayer is a thin polar membrane in the top. The top is the polar, correct? and in between those straight lines is nonpolar. Of the two layers of the lipid, the membrane is a flat sheet and it helps the cell to protect itself. The carbohydrates inside the lipid bilayer, and you can see the carbohydrate, here it is. That's a carbohydrate, for example. They are really helping in communicating with the steroid hormones and neurotransmitters. And we have seen this one in the first section, how the steroid hormones enter the nucleus of the cell and transcription of the DNA into small tiny mRNA, and then which will go outside the outside the nucleus and interact with the protein and activate the protein for specific functions. So this is just a protection belt surrounding surrounding the cell, and it has channels. Those are protein. They have channels, and you will see later on they allow the ions to go in and out. So let's take a mechanism by which those ions and molecules are going through in and out the cell. We have two mechanisms. We have passive transport mechanism and we have active transport. In the passive, meaning we have two possibilities, so two mechanisms. So one called diffusion and one facilitated diffusion. So the diffusion, because if the molecules is so tiny, such as O2, oxygen, carbon dioxide, H2O, they move via diffusion from in and out the cell. So from area with higher concentration, correct, outside the cell, to the area inside the cell with lower concentration. As if you can recall from your survey of chemistry 1, this is really very close to osmosis, correct? This is really osmosis. It goes from higher concentration to lower concentration. Because they are tiny, they can go without any problems. Now, how about if you have larger molecule, larger ions? What we will do then? Well, luckily we have these proteins with the specific channels. They really facilitate this diffusion. So certain specific molecules such as chloride ion, bicarbonate ion, glucose, those are larger, so they go from higher concentration, it's the same like osmosis, correct, outside the cell to lower concentration, and they will be facilitated, the move will be facilitated by the proteins. And remember that we say the proteins, they have channels, they have different type of proteins, different type of molecules and ions, so they transport, they help transport those larger ions. But small molecules, they go by themselves. They can diffuse by themselves. They don't need to go through the proteins channels. The second part is so active transport mechanism. And this is like a reverse osmosis. Why? Because they go like this. So potassium, especially potassium, sodium, and calcium that are transported from lower concentration to the area of higher concentration. This is reverse osmosis. So they go from, so those are active. So how we can do that? It's very hard to do this by themselves. It looks like you need ATP. I don't know, you need ATP to help you, triphosphate, to help you to move those from lower to higher. That's against their concentration gradient. That's difficult to do, the active transport of those ions here. You need some help, and that's help you can see from the picture here. At active transport use ATP. ATP is adenosine triphosphate, is used as source of energy to move the ions and molecules around. This is an active. They go from lower concentration to higher concentration, correct? And this needs some help, and there's a compound here, adenosine triphosphate, helps to provide energy to move those in their opposite concentration gradient. Passive is direct. Smaller, if they are small, they go through, no help. If they are larger, then they need channels. They need the proteins here. This is the protein here. This is another protein. They need to go through protein channels, and therefore we call this is facilitated diffusion. And it goes from higher. This is higher. Outside is higher, the cell, and inside the cell is lower concentration. Let's go further. Now we'll talk about essential fatty acids. Well, those essential fatty acids are not produced in the humans or animals. We need them in our body because they are very important. So therefore, we get them through our meat, correct? So the meat we are eating, and some food we are eating, is rich in those fatty acid. Fish, for example. So you can see that we need those, but we are not producing them, but we need to take them from outside. So such in meat and fish, for example. And really they are very important. Look what they are doing. The essential fatty acids, they help in absorption of fat-soluble vitamins. They help in protecting skin. They fight inflammation. They are precursors for producing of the prostaglandins, correct? Prostaglandins is one part of the fatty acid based lipid. They develop good health and growth, and they are part of cell membrane structure. And here, just an example here, give you linoleic acid, 18 carbon and 2 double bonds, correct? And it goes further to the large one here, deoxyhexyl ionoic acid, okay, 22 carbons and 6 double bonds. So all those are omega-3 and omega-6. So those are the fatty acids, which really we take from outside. We have to eat fish and meat, but we have to be careful with meat because it has a lot of cholesterol, lipids. So and further we can see here, those are examples of the omega-3 fatty acids. You can see here it goes by the number of carbon, 18, and number of the double bonds, 3, and it goes here 20 of carbon and 5 double bonds. This is omega-3 fatty acid. Omega-6, for example, linoleic acid, 18 carbon and 2 double bond. And even an extreme one is DPA. It has 22 carbons and it has 5 double bonds. So they are very important. Let's see what the benefits of those essential fatty acids. I will take just an example, omega-3, and this is the same thing for omega-6. So they fight depression and anxiety. They improve the eye health, correct? They promote brain health during pregnancy and early childhood. They improve risk factors for heart diseases. They reduce symptoms of ADHD disease in children. Reduce symptoms of a metabolic syndrome. Fight inflammation. They can fight autoimmune disease. And the list goes on and on and on. Improve mental disorder, fight age-related mental decline, help prevent cancer, can reduce asthma in children, can reduce fat in liver, can elevate menstrual pain, can improve sleep, is good for the skin. Well, you can see this is a lot of good stuff omega-3, but unfortunately they are not produced inside our body, and therefore they have to be taken externally. And those most of the food is fish. Fish is filled with the omega-3 and omega-6, as well as the meat. But the meat, the problem, the side effect of the meat, it has cholesterol in it. So fish has limited cholesterol compared with the meat. Here is the general physical properties of all lipids being insoluble. The most striking stuff about lipids, they are all insoluble in H2O, correct? And if you look at this, this is just a fatty acid physical properties. Let me go to the, so the saturated fatty acids, correct? They don't have any double bond, so we are expecting them to be solid, correct? And the mono unsaturated, correct? Mono unsaturated, they can be solid or can be liquid. The more you have double bonds, there will be the more chance this compound, this fatty acid will be unsaturated, will be liquid. Now the striking thing about most of them here, they are less dense than H2O. All the fatty acids, all the three types of fatty acids, saturated, mono, unsaturated, polysaturated, correct? All those are less dense than H2O. So they, if you mix them with H2O, they will not mix, and because of the density is less, they will float on the top of H2O. They have lower melting point, you can see, very low melting point. However, the boiling point is very, very high. You can see, very, very high. And the texture, it depends on the double bond. If they don't have a double bond, then that's solid for sure. If they have a double bond, most probably they will be liquid. And you can see, and depending on the molar mass too, the molar mass plays, the larger the fatty acid molar mass, the higher the boiling point, correct? So you can see this is just the fatty acids, and we can go further and look at prostaglandins. The essential fatty acids, those are, all those are the fatty acids we discussed before, correct? The essentially fatty acids. Now those can be used as a precursor to produce all those types here of prostaglandins, correct? Prostaglandin structure. So different number of double bonds with different prostaglandin with double bonds. So you can see here it started with 3 double bonds, and you end up with 1 here. With those with 1. Here started with 4, you end up with 2. 1 and 2 here. You end here you have 4 here double bonds, and here you have 5 double bonds here. See, 5 double bonds. You will end up having 3. So all those 3 prostaglandin are numbered. You can see 1, 2, and 3, and so on. And therefore, the essential fatty acids is very important to produce prostaglandins inside the body. So the different types of prostaglandins, here it is. If you look at this, the different types can be processed and decomposed easily. Some of prostaglandins can cause higher blood pressure, and others can cause lower blood pressure. Some prostaglandins can cause contraction and relaxation in human muscles. And you can see in case of an injury, the arachidonic acid is converted into prostaglandins. In this process, inflammation and pain are appearing in the area of the injury where such conversion had taken place. So if you look at this, some drugs and anti-inflammatory medicine can be used to fight such inflammation and injury. In this process, prostaglandins are converted back into the arachidonic acid. So if you look at this in the process of injury, let's go up here. So the reaction can go the other way. So this reaction can go the other way and can be used. This essential fatty acid can fight the inflammation. And if you look at this, and this type of behavior, when the prostaglandin is reversed, converted into back to the essential fatty acids, we call this type of drugs NACID. NACID is abbreviation for N for non-steroidal, so there are no steroids whatsoever. Non-steroidal, A is anti, I is inflammatory, and these drugs, so NACID, are used as a drugs to relieve the body from any pain or injury. And those are an example of this NACID drugs. Naproxen, such as Aleve and naproxen, ketoprofen, such as Actron, nabumetone, such as Relafan. So those are NACIDs, which is non-steroidal anti-inflammatory drugs. So which really they converted the prostaglandins into its what? Into fatty essential fatty acids, which really relieve one of the fatty essential fatty acids. They relieve what? The body from any inflammation or injury. So here is now looking at the lipids based on fatty acid, their physical properties. We talked about this in general, and this is just repeating with different type of categories or classes of the lipids based on fatty acids. We have 4, correct? We have waxes, we have triglyceride or triglycerol, we have glycerophospholipids and sphingolipids, 4 of them. And the very unique of all those 4 types based on the fatty acids, the unique thing, they are not soluble in H2O, of course. But unique about them here is the density. Density less than H2O, and all of them, they are not soluble in H2O, they float. If you mix them with H2O, they will float, and H2O has heavier density than they are. And if you look at this, their boiling point, all those 4 types based on the acids, their boiling point is very, very high, correct? Very, very high, depending on the molar mass, correct? Just I'm speaking about in general, about the molar mass itself. So, and you can see if they have those fatty lipids based on the fatty acid, they are liquids. Most probably they will have what? They will have double bonds. Solids in general, they have no double bonds in general, but depending on what? Depending on their molar mass. So solids and liquids depend on the double bonds. Now, just here is give you the structure formula of those compounds. Back to the NACID here, and this is in the top. It tells us that if you use too much of NACIDs here every time, and you will be really addicted to it, and that can cause a big damage. It has a very strong side effects, which can cause the kidney to stop functioning, and the gastrointestinal destruction and damage. So therefore, NACID is good for maybe a couple of times, but don't be addicted to it, and let your immune system fight the injury and inflammation. Here, just back out of the conclusion, whatever we have talked about, the melting point and the boiling points of fatty acids and lipids based on fatty acids will depend on the length of the hydrocarbon. That's what I said. The higher the number of a hydrocarbon chain, the higher the molar mass, the higher the boiling point, correct? The higher the long chain hydrocarbon, the higher the molar mass, the higher the melting, the melting and the boiling point. And we have talked about the fatty acids saturated versus unsaturated, monosaturated, and polysaturated. And we said the more we have this unsaturation, the more we have this double bonds, then we have, as here said, the higher the number of the double bonds, the lower the melting point and the boiling point. That's very important for unsaturation. The saturated in general fatty acids will show a higher boiling point and melting point. So they are most of the time what? Solid. But the unsaturated, mono or poly, they tend to be liquid in general. They tend to be liquid and they have lower boiling point and melting point. Now we have the mono unsaturated fatty acids with one single bond. We have the chance to have cis and trans, and we said we have the trans is more stable because it can stagger layers above each self because it's just flat chain. It's a flat chain. While the cis shape has a nick or curved shape, as you can see. And this nick or this curved shape is not allowing the cis form of the unsaturated fatty acid with one single bond to have layers, and therefore the melting point and the boiling point of the cis unsaturated fatty acids with one single bond will have lower boiling points and melting points than the trans one. The trans unsaturated has higher because it can stagger itself in layers, leading to higher stability and higher boiling point and higher melting point. Here we look at the steroids. We talked about cholesterol and the bile salts. And if you look, this is a little bit different story. So you will see the steroids are density-wise, although we don't have the one for bile salts, but in general, the density will be more than H2O. So if you put the steroids inside H2O, you can think sort of, they will not float, they will sink because they are more heavier, more dense than in general. Because the bile salt, I don't have the density of it, but it looks like because of the molar mass is so huge, I can expect this one will sink as well, more dense than H2O. Now, if you look at the boiling points, the boiling points is the same thing like the non-steroidal lipids based on fatty acids, higher. In general, they will be higher. Melting point, again, they are higher. And here, most of those are what? Solid. You'll see solid because they don't have the issue of having a double bond, correct? Like the fatty acid, saturated, no double bond, mono unsaturated, one single bond, and then polyunsaturated, plenty of double bonds. So they have solid. Those we can expect all the steroids will be solid. Okay, that's the physical properties. Let's go further. Now we'll go for the last topic, which is the chemical reaction or chemical properties, chemical reaction of the lipids. And we'll take just one of the lipids, which is very nice one here, the triacylglyceride or the triacylglycerol. This one here can go many reactions. Remember, this one here, this molecule is an ester. The triacylglycerols, they are esters. Triglycerides, they are esters. So we can expect them to react as ester as well. Regardless, they will act as the same reaction we are expecting for esters, they will react as well. So let's look at the combustion. Well, combustion of any organic compound will lead CO2, H2O, and energy, heat, correct? Regardless, all organic compound in presence of oxygen will combust at higher temperature to give us CO2, H2O, and heat. It's an exothermic reaction. The second reaction is hydrolysis. Well, hydrolysis need a catalyst, an acid catalyst, correct? Hydrolysis means you have an ester. The triglycerides are esters. So now if you put an acid as a catalyst, an H2O, then what will happen? You produce one alcohol, which is glycerol, with 3 hydroxy groups, and three fatty acid, carboxylic acid. The same thing in the normal ester hydrolysis. The same thing. The only thing is unique about this. This triglyceride might have different what? Had different fatty acids coming from different fatty acids. So you are producing what? Back you have esters here from 3 fatty acids. You will produce the original fatty acid they came from. They can be identical, they can be different, they can be saturated, they can be unsaturated fatty acids. This is the second reaction. Let's go for the third one. The third one is hydrogenation. Hydrogenation means you are getting rid of the double bonds and produce single bonds. Now, this is in presence of hydrogen, and the name of hydrogen said hydrogenation means you have to use hydrogen, correct? And you need a catalyst, because without catalyst this reaction will go forever. So therefore the catalyst is very, very important. So you're producing from unsaturated triglycerides, saturated triglycerides. So you're producing unsaturated, that's oil. See that it has the double bonds, liquid oil. You're producing fat, solid, correct? So from liquid, you are producing solid. Okay, so you can see the reaction here with hydrogen. Just the only thing here, you have double bonds here, and now the double bonds is here it is, between those two here, is gone. So the double bond is gone here. So the last reaction is saponification. Well, look at the saponification is the same thing with the ester reaction. So saponification is the reaction of a strong base with an ester to produce soap, correct? What is the soap? The soap is the salt of a fatty acids, correct? So now, if I want to make saponification reaction of this ester here, I'm getting my alcohol back, which is here, glycerol, here it is, glycerol, my alcohol back, and then I'm producing soaps here, 3 different soaps depending on 3 what? Different, can you see it? 3 different soaps. And the soap is nothing less, that's just a salt of a fatty acid. This will be, like the first one is sodium balimetate. The second fatty acid is sodium olate, and the third one is sodium linoleate. So you can see, you can have one the same. If the fatty acid identical, you will have one soap, one salt of the fatty acid. But here we have 3 different fatty acids. So here it is, 1, 2, 3, and we are producing 3 different salt and 3 different soaps. Okay. Last thing here, we just put emphasis whatever we have said before. Thus the lipids are very, very important in our bodies. They are source of energy. They are protecting our the inside our cells. They protect and insulate cells, and they provide the essential fatty acids. They control the transport of the ions and other molecules in and out the cell. Thank you very much.